Clostridium difficile colitis is a gram-positive toxin-producing bacteria. The result is pseudomembranous colitis, which is an infection of the colon. 2 months ago, a 75-year-old male stopped taking his long-term course of prescribed antibiotics for a chronic sinus infection. The patient is taken to the ER because of fever. He reported lower quadrant abdominal pain and swelling. He has been suffering from large volume watery diarrhea. The diarrhea has lasted for more than 2 weeks. Also, the patient has had a loss of appetite. The patient has lost 12 pounds in the last month. The most common cause of C. diff is when antibiotics are taken, killing the normal flora of the GI tract, and C. diff is able to populate the colon without any competition. A normal healthy flora consists of majority lactobacillus. Lactobacillus is a mutualistic bacterium that heavily populates a healthy gastrointestinal and vaginal microbiome. In 2017, there were an estimated 223,900 cases of C. diff. During that year, there were 12,800 deaths. Some risk factors for C. diff are advanced age patients, patients that are in hospitals or nursing homes for long periods of time, a long-term prescription of antibiotics, patients that are immunocompromised. The C. diff bacterium produces two toxins, toxin A and toxin B. They are responsible for the degradation of the gut mucosa. Toxin A damages the gut mucosa, whereas toxin B gives C. diff the ability to be virulent and produce toxin A. Toxin A is avirulent. Now, the mucosa cells are responsible for nutrient absorption and waste secretion. C. diff causes secretory diarrhea, and it results in the secretion of crucial nutrients that the body needs to function. This can lead to specific types of anemias or malnutrition. C. diff can cause hypoalbuminemia. This is significant because albumin is a protein that is responsible for transporting molecules into the body. Now, if there's a deficiency in albumin, then it is going to result in anemias. Hypoalbuminemia can occur because the bowel wall is inflamed and it results in albumin leaking into the lumen to be secreted. Constipation is another complication of C. diff. It is caused by the swelling of the colon and can inhibit bowel movements. This swelling is also detrimental because it can apply pressure to surrounding organs, causing pain and disrupt daily life. A toxic megacolon is severe widening of the colon. This could be life-threatening because it adds pressure to surrounding organs and it could possibly perforate. Now in the image, you could see that the colon is significantly wider than usual, right where those arrows are. These are some symptoms of C. diff. Secretory diarrhea, which can lead to the loss of important molecules and proteins, for example, albumin. Abdominal swelling, which can result in constipation and painful pressure on other organs. Nausea, which is the loss of fluids and nutrients. And the loss of appetite, which results in weight loss, fatigue, and malnutrition. Most of these symptoms can lead to many different anemias. A pretty dangerous fact that we have to realize is that there are asymptomatic carriers for C. diff. Now, healthcare workers are the most dangerous spreaders of C. diff because they could be caring for a patient with C. diff and then in the next room visit another patient that is immunocompromised and giving it to them without them knowing. Fortunately, if these healthcare providers do have it, they could pretty much only shed C. diff through their stool. Methods on how doctors properly diagnose patients with C. diff is the NATE test, or the nucleic acid amplification test. It's an analysis of a stool sample specifically looking for the toxin B gene. The good thing about this test is it can detect C. diff in asymptomatic carriers. Another method for diagnosis is an endoscopy. And what doctors do is they stick a camera down your throat to observe your intestines. But this test is for patients who haven't been diagnosed with C. diff yet. The last method of diagnosis is radiographic imaging. And what doctors do is they make the patient ingest radioactive isotopes so they could give better visuals of the GI tract during a CT scan. Now, the picture on the left shows a patient without the radioactive isotopes in their body. And the picture on the right shows a patient with the isotopes in their body. With this method, doctors can get better visuals inside the GI tract and determine whether or not they have C. diff. This method of diagnosis, though, is only for patients with severe symptoms. These are the most common treatments for C. diff. Metronidazole is an antibiotic used to kill the bacterium. Now, if that doesn't work, vancomycin is used as an alternative. And what it does is it suppresses the growth of gram-positive aerobic and anaerobic organisms. So it's perfectly targeted for C. diff. Now, an alternative to medication as a whole, doctors would try a process called a fecal microbiome transplant. And what this process entails is a doctor using a healthy person's fecal matter, injecting it into the rectum of the patient with C. diff. And the end goal of this process is to restore a healthy microbiota in the patient to increase the competition against the C. diff bacterium.